Hello guys, I hope you all are fine. So in this video, I'm going to review again a physiotherapy book, but this isn't just a physiotherapy book. This has actually treated millions of patients with back pain, and it's a self-management book of back pain. So the name of this book is Treat Your Own Back, and this book is written by Robin Mckenzie. So if you're a physiotherapist, you must be knowing a technique. The name of the technique is Mckenzie, and this technique was developed by the world-renowned person, and the name is he's a physiotherapist in New Zealand, I guess, and he's a world-renowned because of this technique, the Mckenzie technique. So in this book, he has actually written this book for the patients or for anyone who is suffering from the back pain, and there are evidences that many people got treated just by reading this book, because in this book he has beautifully written the diagrams and the steps by step process how to treat your back pain and how to know which movement is painful, which movement is not painful. So this book is written in very simple languages so that every person can understand. It's not just for physios, but if a physiotherapist can read this book, he can also treat patients in the same manner. So there was a story, very interesting story of Mr. Smith in this book. It's kind of how he got treated by this technique, and this technique was discovered like by surprise or by chance. This technique just got a few after getting this recognition of this technique. What Robin Mckenzie did, he did some evidences, he gathered some evidences, he did many experiments in different parts of the world, and then he introduced this technique, Mckenzie technique. So there was a patient, his name is Mr. Smith. He came to his clinic and he was like, I'm suffering from back pain, and it's very worst pain, and not I'm not getting relief by anything. So he said, okay, just wait in my cabin or wait in my area, and then I'm coming in 5 minutes. So by that time, he just lie on the table and in the prone position, and the head of that table, it was a tilting table, and it was head was up. It was like the back was arched reversely. Okay, so like it's like a cobra position. So it's the table was built in that manner. So what happened after he came from his break? So Mckenzie thought, oh my God, his pain is going to be increased, because on those times people don't think that these things work, and he was like, this position is very bad for these kind of patients, for back patients, and now he's going to scold me because now he'll have increase in back pain. So he asked, so Mr. Smith, how are you now, and how is your back pain? The patient said, ki, my back pain is fine, now I'm not feeling any pain, any kind of pain. And then he went away, and he was shocked, that in just 5 minutes, how he got 5 to 15 minutes, whatever the time was, how he got relief. And he was so scared that if the pain will increase, he will scold him. So then he started observing things, why these patients are saying that in getting prone, their pain is getting relief, but how? Why, when, how much to do, and what is the right way of doing this technique. So it has been all written in this book. So I actually used to take lectures of this technique, but it's a big lecture, approximately 2 hours lecture, so that I cannot take 2 hours lecture in this 5 minutes video. So that's why you have to read this book. And this book in this book, the Robin has said that back pain isn't just a very serious condition, because people are making it serious, because sometimes it's very new condition also, like mechanical condition or very poor posture because of prolonged sitting, and because of mechanical dysfunction. So this technique is also being called as a mechanical diagnosis therapy, or MDT. MDT is called as techniques. So it also identify or helps the reader to identify the movements which relieves in pain and which increasing the pain, like aggravating and relieving factors of the pain. So the three things which you can get from this book is, first is movement is medicine. The more you move in a definitely a certain way, then your pain can get better. The second thing is posture awareness prevents pain. So if you have a good posture, if you are doing good postural exercises, then your pain will definitely be going to reduce. The third thing is self-treatment works. So even a patient can manage and treat himself and or prevent rather than treating, he can prevent himself from getting injuries of back pain or any spinal injuries. Okay. So my story about this book is very small, small thin book, and the page was like treat your own bag. There's a guy on this cover of the page, so I liked the book, and I also heard about this technique, Mckenzie technique, in my college days. So I thought, okay, why not to try this book? And I brought this book and I studied it, and it was very good. Very simplified book. I would rather say it is very simplified. There are all steps given. Step one, do this. Step two, do this. So there are 6 steps of this technique. I don't want to reveal all the techniques here in just this video, because you have to read this book, or else you have to attend lectures, because you can't get these techniques just by watching the videos. These are practical things. And so in my opinion, treat your own book is a must read, and it's not just for physios but for anyone who's even ever suffered from the back pain. It is simple, evidence-based, and real results without the fancy equipments. You don't need any equipment for this. And it's just not a book, it's a self-healing toolkit. So I hope you are learning from these reviews and you are getting to know about the new techniques and how these techniques develop. Because if you talk about the history of all the techniques, how they develop, it's amazing. You will be astonished to know about all these techniques. So thank you so much for watching these videos, and see you next video. Till then, keep learning and keep subscribing. Keep subscribing, and don't forget to on the notification, or just click on the bell icon. Thank you so much. Bye.